You're watching CTOM TV. Knowledge is power.
Precision oncology takes a slightly different look at lung cancers, and often you will see, um, different sorts of precision oncology being used in lung cancer treatment in standard care, but it's not uniformly applied across all of the different facilities and countries. So one of the most important things in precision oncology in diagnosing a lung cancer is referred to as a PET-CT. So a PET-CT is a little different than other imaging. Other imaging techniques require that you measure the size of a suspicious lump and then follow it over a period of time and watch to see if it grows. And if it grows, then it's assumed to be a cancer. Now, that's not always the case, and that can really delay your treatment diagnosis, your treatment and your, getting a proper diagnosis. So a PET-CT is an excellent tool because it detects cancer in real time. And the way it does that is they inject you with a radioactive isotope that's attached to a sugar molecule, and then they give you a CT scan. And so the concept here is that any active tissue or highly metabolically active tissue, such as a tumor, which is constantly growing and constantly copying itself, the cells are constantly reproducing, and it's highly metabolic, is going to drink up more of this sugar radioactive solution than the other tissues, the surrounding tissues. And therefore, anything that drinks up more of this radioactive isotope is going to glow when you get a CT scan after you've had this injection. And so it's very effective. CT scans and X-rays, while they can detect a lump, they can't tell you whether it's a tumor or not. Whereas a PET-CT can tell you whether it's a tumor with a single scan. You don't have to wait for months to see if it grows. And so part of that is done through what we call the SUV activity. And that's the serum uptake value. That's how much of the actual radioactive isotope sugar that the cancer cell drinks. And so the more it drinks, the more aggressive it is, and the higher the SUV value is. So unfortunately, there's not a lot of PET-CT machines in Canada. It is used commonly in Europe, and in Asia, it's fairly commonly used. And of course, the United States has many different facilities. I think in many cases, a PET-CT can drastically change the diagnosis and the treatment. In many cases where a patient has a single lump and is staged as a lower stage, when we get them a PET-CT, often they have other tumors that were missed by the CT and the MRIs. So CTs and MRIs are, for diagnosing cancer, probably about 50 to 60% accurate, whereas a PET-CT is in the mid to high 90s for accuracy and sensitivity and specificity, which is false positives and false negatives. So it's a great tool to have, and in at least 80 to 90% of the time, when a patient gets an external PET-CT or a private PET-CT, it changes their diagnosis, and the treatments are often modified. So very important tool. And once again, we've seen patients who have had, had a higher stage of cancer than they were initially diagnosed, and that was only determined after the PET-CT. We've actually seen a few cases where patients, in fact, one specific case of lung cancer where a patient was on his 6th course of chemotherapy. And when we got them a PET-CT scan, we found out that they never had cancer in the first place. It was just a benign lump they had in their lung. So PET-CT, very important. And Michelle's put this statistic at the bottom that I think is important. Michelle, would you like to explain that statistic to us?
Sure. The Canadian medical system has a lot going for it, but in terms of diagnostics for cancer care, we're 23 out of 28 countries with public health care programs surveyed by a recent study from the World Health Organization for how we diagnose cancer care or the quality of our cancer diagnostics. So we have a natural sense that our medical system is looking out for us, taking good care of us, and it is to the best of its ability. But there are some areas where we're not even close to the top. And when it comes to cancer, of course, you want to make sure that you're using the best possible resources, especially when it comes to diagnostics. And when Alex was talking about, people finding out through PET CT, they have a higher stage. What he means is often, well, it probably means a lot of things, but in terms of the aggressiveness of the tumor, perhaps. But what I often hear about on my side of things is with standard care diagnostics, somebody, the oncologist or radiologist was just looking in the location of the primary tumor or what they thought was the primary tumor. And so a CT scan or an X-ray is maybe very localized. A PET CT is essentially a full body scan. So it's also really beneficial because it kind of overrides the assumption that there are no metastases and allows you to know for sure if there are, which of course then elevates your stage. And another great benefit, if I could call it that, with all due respect to what you're dealing with, of knowing whether you have metastases or not, or whether you have a higher stage than you were previously diagnosed at, is it does elevate your case. It does make you get kind of faster, better care oftentimes. So just knowing for sure where the cancer is and isn't in your body, and how aggressive your tumors are, can really change the way your doctor treats you, as it says here, 80+% of the time.
Thank you for watching CTOM TV. Subscribe below and stay informed.